Hello, my name is Alexa Nasty, and I am a family nurse practitioner and doctorate of nursing practice candidate. This slide is to educate the public on a known global health issue, tuberculosis. This slideshow will discuss the disease itself, transmission, testing, treatment, and prevention of the disease. What is tuberculosis? Tuberculosis is a bacterium caused by Mycobacterium tuberculosis. The bacteria usually attacks the lungs. However, TB bacteria can attack any part of the body, including the kidney, spine, and brain. Also, not everyone infected with TB bacteria becomes sick. As a result, two TB-related conditions exist: latent TB and TB disease. As you can see on the photo, which will be discussed in greater detail later on, these are the stages of TB disease in the lung, ranging from latent to active and progressed infection. If not treated properly, TB disease can be fatal. Due to alarmingly high rates throughout the globe, drug resistance has become a major issue in curing patients of tuberculosis. This is a map taken from the WHO Global Report 2020 of where tuberculosis is prevalent. Most people who are infected with tuberculosis live in low or middle income countries, as shown on the map. Half of all TB cases in the whole world can be found in 8 countries: China, Bangladesh, India, Indonesia, Nigeria, Pakistan, the Philippines, and South Africa, as seen in red on the map. How is tuberculosis spread? TB bacteria spread through the air from one person to another, meaning it is spread through airborne particles. When a person with TB disease of the lung or throat coughs, speaks, or sings, TB bacteria can get into the air. People nearby may breathe in these bacteria and become infected. TB is not spread by shaking someone's hand, sharing food or drinks, touching bed linens or toilet seats, sharing toothbrushes, or kissing. When a person breathes in TB bacteria, and the exposure time is usually within 6 feet for longer than 15 minutes without the proper PPE or mask, the bacteria can settle in the lungs. After a person has been infected, the disease can then move from the lungs into the bloodstream, affecting other vital organs. The people at most risk of TB are the ones who spend every day with the infected person in the same living quarters, like family members, close friends, coworkers, or schoolmates. Here are some quick facts regarding TB from the WHO. 10 million people every year are infected by tuberculosis. Despite being a preventable and curable disease, 1.5 million people die from TB each year, making it the world's top infectious killer. To put this into perspective, 650,000 people die from the flu every year, making TB more deadly. TB is the leading cause of death in people with HIV and a major contributor to antimicrobial resistance. About a quarter of the global population is estimated to have been infected with TB bacteria. But most people will not go on to develop TB disease, and some will clear the infection. Those who are infected but not yet ill with the disease cannot transmit it, or people with latent TB. People infected with TB bacteria have a 5 to 10% lifetime risk of falling ill with TB. Those with compromised immune systems, such as people with HIV, malnutrition, or diabetes, or people who use tobacco, have a higher risk of falling ill. On the right is a poster from the COVID-19 pandemic, which shows how the COVID-19 pandemic has posed some major setbacks regarding the identification, treatment, and prevention of TB. These setbacks were caused by misdiagnosis, fewer people seeking medical attention during the pandemic, fewer people treated that did seek medical attention, and fewer funds and resources were allocated to essential TB services during that time. Symptoms of TB. The most common form of tuberculosis is pulmonary TB, which causes respiratory symptoms. The hallmark signs that may alert a provider that you may have been infected with pulmonary TB would be a bad cough that lasts 3 weeks or longer, pain in the chest, hemoptysis or coughing up blood or sputum, phlegm from deep inside the lungs. Other symptoms of TB disease are also weakness and fatigue, weight loss, no appetite, night sweats, fevers, or chills. Latent TB has no symptoms, meaning you may have contracted the virus but are not yet infectious or exhibiting symptoms. As discussed previously, according to the CDC, not everyone infected with TB bacteria becomes sick. As a result, 2 TB-related conditions exist: latent TB infection and TB disease. Latent TB infection means that TB bacteria live inside the body without making you sick with the disease. In most people who breathe in TB bacteria and become infected, the body is able to fight the bacteria to stop them from growing. People with latent TB infection have no symptoms, don't feel sick, can't spread TB bacteria to others, usually have a positive TB skin test reaction or positive TB blood test. They may develop TB disease if they do not receive treatment for latent TB. Many people who have latent TB infection never develop TB disease. In these people, the bacteria remain inactive for a lifetime even without causing disease. But in other people, especially people who have weakened immune system, the bacteria can become active and cause the TB disease. People with TB disease, the bacteria becomes active if the immune system can't stop the bacteria from growing. When TB are active or multiplying in your body, this is called TB disease. People with TB disease are sick, and they may be able to spread the bacteria to the people they spend time with every day. Many people who have latent TB infection never develop TB. Some people who develop TB disease soon after becoming infected before their immune system can fight the TB bacteria. Other people may get sick years later when their immune system weakens for another reason. For instance, some people in pregnancy develop TB from latent TB. For people whose immune systems are weak, especially those with HIV infection, the risk of developing TB disease is much higher than people with a normal immune system. How do healthcare providers test for tuberculosis? There are a few ways to test for the disease. Some jobs require routine tuberculosis testing, like those in the medical field. There are 2 kinds of tests used to detect TB bacteria in the body: the TB skin test, or PPD, and TB blood tests. A positive skin test or TB blood test only tells that a person has been infected with TB bacteria, but neither tell whether the person has latent TB infection or active TB disease. A chest x-ray and sputum samples are needed to see whether the person has the disease. People who have had the BCG vaccination need to be tested with blood tests, or IGRAs, as they are the only way to accurately detect TB in this group. The TB skin test is also known as the mantle-tuberculin skin test, TST. A TB skin test requires 2 visits with a healthcare provider. On the first visit, the test is placed. On the second visit, the healthcare provider will read the test. The TB skin test is performed by injecting a small amount of fluid called tuberculin into the skin on the lower part of the arm. A patient given the tuberculin skin test must return to the provider within 48 to 72 hours to have a trained healthcare professional look for a reaction on the arm. The results depend on the size of the raised hard area or swelling. If the test is positive, additional tests are needed to determine if the person has latent TB infection or TB disease. Interferon gamma release assays, or IGRAs. These are the blood tests for TB infection. Currently, there are 2 on the market in the United States. the quantiferon TB Gold, and the T-Spot TB tests. Interferon gamma release assays, or IGRAs, are whole blood tests that can aid in diagnosing Mycobacterium tuberculosis infection. They do not help differentiate between latent tuberculosis infection from tuberculosis disease. So both the tests, the skin tests and the blood tests, need additional testing to determine if the patient has active disease or latent disease. IGRAs work by IGRAs measuring a person's immune reactivity to M. tuberculosis. White blood cells from most persons that have been infected with M. tuberculosis will release interferon gamma when mixed with antigens, or substances that can produce an immune response, derived from M. tuberculosis. The medications used to treat latent TB infection include isoniazid, or INH, rifapentine, or RPT, or rifampin, RIF. These medications are used on their own or in combination to treat latent TB. CDC and the National Tuberculosis Controls Association, or NTCA, preferentially recommend a short course rifamycin-based 3 or 4 month latent TB infection treatment over 6 to 9 months of isoniazid monotherapy. The treatment course is ultimately up to the discretion of the provider, and it's also up to what they feel that the patient will be most compliant with following to eradicate the disease. Same for treatment of active TB infection. There are several treatment regimens recommended in the United States for TB disease, which can take 4, 6, or 9 months depending on the regimen. TB treatment can include 4 months of rifapentine moxifloxacin TB treatment, 6 or 9 months of RIPE, which means rifampin, isoniazid, pyrazidamide, and ethambutol, which is another TB treatment regimen, or shorter regimens that can help patients complete the treatment faster. Healthcare providers can choose the appropriate TB treatment regimen based on drug susceptibility results and coexisting medical conditions, as a lot of these medications interact with other meds. It is to note that all these medications have side effects that have made adherence difficult. Frequent follow-up with a healthcare provider as well as the DOH is imperative to have the patient maintain their treatment regimen. This is a slide that could show some, but not all, of the side effects of common tuberculosis treatment medications. For instance, rifampicin can cause discoloration of your urine. It can make it look red. Isoniazid can cause drug-induced lupus, B6 deficiency, and neuropathies. Pyrazinamide can cause GI symptoms like vomiting, hyperuremia, and gout, which is very painful. And ethambutol can cause optic neuritis in the eyes. So these are many side effects that are very unpleasant to patients and cause them to stop taking treatment when it's imperative that they continue and complete it. There is a vaccine called the BCG vaccine that is available in certain countries and in the United States to certain patients. The Bacille-Calmette-Guerin is a vaccine for tuberculosis. It is not widely used in the United States, as I said before, unless patients meet specific criteria. The BCG vaccine should only be considered for children who have a negative TB test and are at very high risk of contracting the disease, like those who are continually exposed to someone with tuberculosis. The BCG vaccine of healthcare workers should be considered on an individual basis in settings with a high percentage of TB patients, also under certain circumstances. Vaccination with BCG may cause a positive reaction to a TB skin test, so it is important for your provider to know if you've been vaccinated with the BCG vaccine. A positive reaction to a TB skin test may be due to the BCG vaccine or infection. TB blood tests, however, unlike the skin test, are not affected by prior BCG vaccinations, and they are the preferred test for patients that are vaccinated with the BCG vaccine prior. This is superior for these patients. And then again, if their test was positive, they would still need a chest x-ray or some sputum samples to determine if it was or is latent TB. Drug-resistant TB can occur when the drugs used to treat TB are misused or mismanaged. Sometimes drug-resistant TB can occur when the bacteria become resistant to the drugs used to treat TB. This means that the drug can no longer kill the TB bacteria. Drug-resistant TB or DRTB is spread the same way that drug-susceptible TB is spread. People do not complete a full course of TB treatment is also a risk of developing drug-resistant TB, as well as healthcare providers prescribing the wrong treatment, either the wrong dose or length of time. Drugs for proper treatment are not available, so they are treated with subpar options, and drugs that are of poor quality. Drug-resistant TB is more common in people who do not take their TB drugs regularly, do not take all of their TB drugs, like finish the whole course, develop TB disease again after being treated for TB disease in the past, come from areas of the world where drug-resistant TB is common, or have spent time with someone who's known to have drug-resistant TB. Preventing latent TB from progressing into TB disease. Treatment of people with latent TB is easier than treatment of a patient with TB infection due to a lower disease burden, which means there's less bacteria floating around through the body. You should speak to your healthcare provider about treating latent TB. People at high risk for developing TB disease with latent TB include people with HIV, people who became infected with TB bacteria in the last 2 years, babies and young children, people who inject illegal drugs, people who are sick with other diseases that weaken the immune system, elderly people, people who are not treated correctly for TB in the past. It is also important to prevent TB exposure while traveling abroad. Although multi-drug resistant TB is occurring globally, there are still areas where it is, prominent. So precautions should be taken in these areas. Air travel does pose a very small chance of contracting TB, but once you are at your destination, if you know you are high risk for developing the disease or contracting disease like those with HIV, extra precautions should be taken when traveling to areas where TB is present, like avoiding large crowds, clinics or hospitals where TB is highly prevalent, or very enclosed environments with a lot of people. For any questions regarding this slideshow, please email me at alexa.nasty@wagner.edu. World Tuberculosis Day is March 24th. Each year, the CDC recognizes World TB Day. On this same day in 1882, Dr. Robert Koch announced his discovery of Mycobacterium tuberculosis, the bacillus that causes TB. World TB Day is a day to educate people about the impact of TB around the world. The CDC and their partners share successes in TB prevention and control to raise awareness to the challenges that hinder progress toward elimination of this devastating disease. These are some helpful links for more information, like patient testimonials and the Global TB Report. And these are my references. Most of my information was taken right from the WHO and CDC. Thank you all for listening to my presentation.